Good afternoon, everyone. My name is Jason Schaffenbuhl, and I am the host and presenter for today's webinar. Hopefully, if you couldn't hear me before, you hit reconnect and you've got all that taken care of. I had the same exact issue on the computer I monitor from. So I'd like to start today. Welcome to the January 2021 West Bend Mutual Insurance Company webinar on OSHA record keeping. We do monthly webinars on a variety of topics. This is by far the most popular one year after year because so many of you have so many questions about OSHA record keeping. I would love to say this is going to take exactly an hour, but I'm afraid it's probably going to go to an hour, maybe an hour and 15 minutes, but we're going to do our best. I'm going to do my best to keep to the schedule. If you have any questions, please feel free to chat in the chat window. I'll do my best to follow along and respond to all those. The handout should work. Forgot to double check that earlier. They worked for me just now, so the handouts are available, and please feel free to follow along. OSHA record keeping, I think the key is well, the agenda, I'm sorry. Want to talk about OSHA an injury or illness is recordable, including the consideration of COVID-19, properly counting lost and restricted workdays, the annual posting electronic submission requirements, and then which injuries require prompt notification to OSHA. I could probably spend an hour alone just on the first bullet there. So we're going to do our best to get through all of this, as I promised. The first thing I always want to start with is some of you may be on here and don't know if you have to keep an OSHA log or not. And there's a couple of different factors. The first is if you have fewer than 10 employees, and that's across all locations, you're exempt. So if you have less than 10 employees, don't worry about keeping an OSHA log, and that's across all locations. If you have 10 locations, I'm going to make this easier. If you're going to have 11 locations with one employee at each location, you may have to keep an OSHA log. It's important to realize even if you're exempt from keeping an OSHA log, you're still not exempt from reporting fatalities, hospitalizations, enucleations, and amputations, which I'll cover on towards the end of this presentation. So if you have more than 10 total employees across your entire enterprise, you still may be exempt from OSHA. Specifically, OSHA has this list, and there's 2 pages here. So the first page, and then I'll show the second page in a little bit. These businesses are exempt. They're exempt unless OSHA comes and says, or OSHA or the BLS comes and say, oh, I'm sorry, you need to keep an OSHA log. So some of you may be on here and say, yeah, I'm in an exempt industry, and you still need to keep. The question was asked, we're a government entity. Do you still need to keep an OSHA log? Depends on what state. The state of Nebraska, if you're a government entity, the answer to that is no. You're the state of Wisconsin. The answer to that is yes. The state of Illinois. I can't remember off the top of my head in Illinois. If you're in Iowa or Minnesota in your government entity, yes, you still have to keep a log as long as you're not on the exempt list. Yes, Don, as long as you're not exempt from an OSHA log for the other reasons listed, you would still have to keep an OSHA log being in Wisconsin. So I'll go on to the second page of exempt businesses. And there's not a lot of you participating that West Bend insures that would be in some of these, but it's the nature of record keeping. They want to make sure that you're keeping a log if you need to. So we'll assume that you're here now and you had to check. So recordability. The most important thing here is what makes something recordable. And the same here applies to COVID-19. And then I'll come back at the end of this to talk specifically about the caveat of COVID-19. So the first thing you have to do is, didn't the employee experience an injury or illness? And the question is it an employee? And OSHA says that an employee for OSHA record keeping purposes is any person that's on your payroll. They're clearly an employee. Any individual you supervise that is not on your payroll on a day-to-day basis, then they should be on your OSHA log. And this gets a little tricky. If you have temporary service employees that come into your facility and you provide them with direction on their day-to-day activities, then you're supervising them and their injuries go on your OSHA log. If, however, you have a temporary service agency, you say, look, we need 6 people and they need to do this, and you don't supervise them, that the temp agency supervises them to make sure that they're doing the job properly, then OSHA says those injuries go on the temp services OSHA log. And I used to know some temp services, they don't want high injury illness rates, so they call up the employer and say, you need to put this on your log. And the employer says, look, we don't supervise them. You send them here, they take care of this, they take care of that. They go on your log. It's clear, like if you have a Xerox copier person come in to maintain your Xerox copier, you're not supervising them. They're paid to do a job. It gets a little tougher when you're maybe going through a Manpower or another temp agency, and they may not let you, and they supervise or not supervise. It's pretty clear if you're supervising them or not. But this one gets to be tricky at some times. And then again, contractor injuries do not go on your log unless you supervise their day-to-day activities as well. So what defined as an employee for the purposes of the OSHA log is different than what would be an employee for workers' compensation. And it's important to realize what's compensable isn't always recordable, and what's recordable isn't always compensable. 95% of the time they overlap, but not always. So the first thing we ask is, is it an employee? We'll assume it is. And so we then go to, is it work-related? This one gets to be tricky for COVID-19, so I have a whole set of slides on that. But OSHA says, look, if it happened in the work environment, or the work environment caused or contributed to the resulting condition, or it aggravated a pre-existing condition, it's work-related. They make it really simple. There are some exceptions to what work-relatedness is, and I'll get into those. But significant aggravation of pre-existing condition. If the employee dies because of a work-related incident or exposure, that's recordable. Loss of consciousness, lost or restricted workdays, medical treatment beyond first aid, all considered work-related. If those things happen, it's all considered work-related, as long as it's due to the work environment. And so we'll talk about it. For most things, it's really easy to comprehend if it's work-related. COVID has really turned this upside down, and so OSHA has given some specific direction on COVID and how you determine if COVID is work-related. I'd love to say it's clear. It's clearer than mud, but it's still quite foggy. So those exceptions to being work-related. OSHA says, look, if the employee is in your work environment as a member of the general public and not as an employee when they're injured, then it's not work-related. Perfect example is you run a store, your Walmart, and an employee is in your store shopping. When they slip and fall, if they're in there shopping, then they're an employee. They're not an employee at the time. It wouldn't go on the OSHA log. If they're working, then it's going to be work-related. If a sign or symptom surfaces at work, but the condition is from a non-work event or exposure, would not be work-related. I'd love to say the common cold would be a perfect example of this. A person gets a cold, they get a runny nose, a sniffly nose, and just because it surfaced at work doesn't mean it's work-related. And so that's an issue. Specifically with COVID, that's an issue. And so we'll talk about how OSHA wants COVID handled. If the employee is voluntarily participating in a wellness program, a medical fitness program, or recreational activity such as donating blood, a physical exam, a flu shot, a COVID shot, and it's purely voluntary, and they happen to be in the work environment when they're getting their shot, that would not be recordable under OSHA's record-keeping requirements. Now, if you mandate they get the COVID vaccine and they're injured from that, then, or they have a reaction that requires medical treatment beyond first aid, lost or restricted work activity, those things, then that would be recordable. Compensability is going to be completely different than this, or somewhat different than this. If the injury results from an employee eating, drinking, or preparing food or drink for their personal consumption, not related to the work, that would not be considered work-related. Had an example a few months ago where an employee was drinking on the job, or had drunk before the job and was drunk. And OSHA says, where the impairedness of the drinking the alcohol was what was led to the injury, OSHA says that shouldn't be recorded. If it results from the employee doing a personal tasks unrelated to their employment outside of assigned working hours, again, not considered work-related. So the employees taking care of personal grooming, I think, might be next. But if they're if maintenance employee using a table saw to build a birdhouse, and it's outside of their assigned working hours, that's not recordable. The employee's building the birdhouse for personal use during work hours, then that could be recordable. The break time is going to be a little tricky. Again, other exemptions, that personal grooming, self-medication for a non-work related condition or any self-inflicted activity. any motor vehicle accident occurring on the company parking lot while the employee is coming to or from work. So if they're involved in a car accident, their car hits somebody else's car and they're injured in the parking lot, not recordable. They slip and fall in the parking lot, then it is recordable. The common cold or flu, which we kind of mentioned under symptoms just showing up at work, and mental illness. Mental illness is not considered work-related unless a licensed healthcare professional states that the employee's mental illness is work-related. Traveling employees. Traveling employees get to be a little tricky. You have to look at what the employee was doing at the time that they were injured while traveling. If they were in the course of their work activities, if they were in the interest of their employer, then that would be considered recordable. If they're doing something personal, if say you have an employee that travels to another state to see one of your facilities there, they were at the facility, they did their work, and they were going back to the hotel room, and at their hotel room they slipped and fell, that wouldn't be work related. While they went out to eat for supper, that wouldn't be considered work related. But if they went out to eat for a business meal, they were meeting with other peers or customers, and they were injured while doing that, assuming they weren't choking on the food, but if they were injured, slip and fell, then that would be considered recordable. And so it gets to be complicated. And so you just have to look through those things. Basically, what OSHA says is you treat hotels like home. Once the person gets to the hotel room, as long as they're not doing something at the hotel for the interest of the employer, then that's no longer considered recordable by OSHA. But if you have questions on those, feel free to ever call me. I can help answer those questions, refer you to the proper documentation OSHA has on those. Because it is tricky, but usually we can find an answer for you quick. With COVID and other times, a lot of employees are working from home. OSHA says, look, if that employee's at their home and they're doing something related to the performance of their work and not the general home environment, then that would be considered recordable. So you have an employee, they're doing some paperwork at home, they drop a box of the documents on their foot and they fracture their foot, that's going to be recordable. If they're walking down the stairs and they're getting themselves a snack at lunchtime and they trip over the family dog, OSHA says, look, that's not recordable. And again, these are going to be completely different when it comes to compensability depending on the state, so it makes it exciting. So then, after we look at is the injury to an employee, is the injury work-related, then we get to the third question, is it a new injury? Probably the easiest one to answer. It's new if the employee has previously not experienced a recorded injury of the same type that affects the same body part, or they had an injury, similar type, similar body part, but they'd recovered completely, no signs or symptoms. If it's new, it's new. If it's a re-aggravation, it's a re-aggravation. So if it's new, it goes on the log as a new entry. If it's a re-aggravation of a prior entry, if it's happened within the last 5 years, you go back and update the log from up to 5 years ago. And so this is one of the things that employers often forget is they have to go and maintain prior year's OSHA logs and keep them updated. Then we get to the general recording criteria. So we have an employee with a new work-related injury or illness. Then we ask ourselves the fourth question. Does it meet the general recording criteria? To me, a lot of these are really easy. Death, lost time, restricted work activity, medical treatment beyond first aid, loss of consciousness. Those are the standard ones. If it's a hearing loss, a standard threshold shift, needle sticks or sharp injuries, where the needle or sharp was contaminated with potentially infectious material, significant injuries and illnesses, diagnose significant injuries and illnesses, OSHA medical removal. There's some standards that require medical removal. There's lead would be one of them. And so if an employee is overexposed to lead and their blood levels come back high, then they may be required to be removed from work. And then work-related tuberculosis exposures. A question was asked, and I'll try to come back to that when we get to the COVID section, because it's going to be I'd like to say a convoluted answer would be the nicest way to say that. The simple criteria, as I said, death, needle stick, where the object is contaminated with potentially infectious material, work-related tuberculosis, and standard threshold shifts are pretty much undeniable. The standard threshold shift, there is a way you really should retest the employees within 30 days. If you retest them within 31 days and it finds out it wasn't a sustained threshold shift, you can't take it off the log. But if you test within the first 30 days and you find out that the standard threshold shift isn't persistent, then you can take it off. And the standard threshold shift is a loss of 10 decibels of hearing or more in any one of the employee's ears. And so you'd only be doing, you'd only know if you have a standard threshold shift if you have a hearing conservation and program in place and you're doing audiograms and seeing that there is a loss of hearing. Lost time. Lost time is relatively easy to understand in most cases. Lost time is any time a physician does not allow an employee to return to work for more than the day of the injury. If I get injured today and I go to the doctor today and the doctor takes me off of work until tomorrow or through tomorrow, I only count tomorrow as a lost time day. I do not count the day of the injury. If a supervisor tells an employee to stay off of work because of an injury, that's going to be considered lost time. If you have a supervisor tell an employee to stay home due to COVID-19, that's going to be a lost workday. OSHA has not clarified that because I would disagree, but that's the employer or the supervisor keeps an employee off work. That is a lost workday, and we'll come back to that, how COVID interplays with that a little bit. And you also count lost work time when a physician recommends the employee stay home. The physician gives the employee restrictions to say stay home, but the employee returns to work anyway. Even though the employee is working, you still have to count those as lost work days. Now, if a physician recommends an employee to go back to work and an employee keeps themselves off work, either they request to take PTO or they just refuse to show up at work, then those are going to be, then you don't count those days. It's not at the employee's discretion. It's what the employee was directed to do by a physician or the employer. And I see lots of questions, and I'm going to ignore them for a while. You know, and we'll come back to this. Transfer restricted work activity. A transfer occurs when you transfer an employee to a different job because of the injury or illness. You have an employee, let's say they work as a clerk in the warehouse and they have to pick 20-pound boxes. And they get injured and they get right away the doctor says, well, they're going to have a permanent restriction of no lifting over 10 pounds. And so you say, look, they can't do this job anymore. We're going to make a transfer to a different position where they don't have to lift. OSHA says, look, you still have to count that. You're going to count at least 1 day of restricted work activity because of that transfer. A restriction occurs when a physician or employer keeps the employee from performing one or more of the routine functions of the job or from working a full workday. And that gets tricky because the routine function is clearly defined by OSHA, but it's hard for a lot of businesses to interpret. As a routine function is anything an employee does at least once per week. So let's say an employee once a week has to lift a 50-pound box of paper to restock a copier. And they get injured and they have a 40-pound lifting restriction. The doctor says, don't lift anything over 40 pounds. And they don't do anything in their job over 40 pounds the entire week except the 1 day they have to fill that copier up, and they can't do that. OSHA says you're going to count at least 1 day of restricted work activity for that. And so it gets to be tricky when it comes to that. Restricted work activity is when an employee gets a restriction. Just because an employee gets a restriction from a physician does not mean that the case is automatically considered a restricted workday case. You have to look at the restriction. Does it impact the routine functions? If an employee gets a restriction, such as myself, let's say I slipped and fell. I'm an office employee. I don't lift anything. Most people would say I'm relatively lazy. Office employee, I don't lift anything. No lifting, bending that I routinely do as part of my job. I sit in a chair, stand up, and go to meetings, type emails. That if I slipped and fell in the parking lot and the doctor gave me restrictions, it's not impacting my function. I can come to work. I can still do my job. So those restricted work days wouldn't be counted. Now, if you're maintain that an employee just can produce fewer goods, if the employee produces 200 widgets on a normal day and a doctor says, you know, I think they can only produce 50 widgets, that in and of itself doesn't make it restricted work activity. They're still doing their regular job. The restrictions didn't impede them other than doing fewer things. We don't see many restrictions like this, but it does occasionally happen. And so that you wouldn't be counting restricted work days in that case. And you have to determine then if that's the only reason you were going to make it recordable, you have to look at the medical treatment. So medical treatment beyond first aid. This is the one that makes most things recordable. If it didn't have lost restricted work activity or standard threshold shift, medical treatment beyond first aid is what makes it recordable. So you have to look at this. There's 14 things OSHA says is considered first aid, and if it's anything other than those 14 things that the employee got for treatment, then it's going to be considered work-related. Just because an employee goes to a doctor doesn't mean that it's recordable. If an employee just has x-rays or diagnostic tests, it doesn't make it recordable. It's the diagnosis from that possibly that would make it recordable. And first aid, as long as the first aid is one of these 14 things. If a doctor prescribes non-prescription meds at non-prescription strength, that's not OSHA recordable. So if a doctor says, go and take over-the-counter Tylenol, you'll be fine, and the employee does or doesn't do that, that doesn't make it recordable. If the employee just gets a tetanus shot, that doesn't make it recordable. If the doctor just cleans or flushes the wound on the surface of the skin and doesn't do stitches and doesn't do those types of things, that isn't recordable. It's just first aid. You can go in, doctor cleans it up, or anybody can do these things. It can clean it up and it's not recordable. If they use wound coverings such as Band-Aids, gauze pads, butterfly bandages, or steri strips, that treatment is considered first aid. Hot or cold therapy, hot packs, heat packs, considered first aid. A non-rigid means of support such as elastic bandages. Devices with rigid stays are considered medical treatment, but if they're non-rigid, then it's first aid. And this really gets funky because sometimes an employee will have a sore wrist and they'll put an employee in a wrist brace. If it has a rigid means of support, if it's got a metal stay in it, it's going to be recordable. If it doesn't have a metal stay in it, assuming it's work-related, new, and all those other things, if it doesn't have a metal stay in it, then it's not recordable just because of that device, that aid. If you just put a neck collar on somebody to immobilize them during transport, that's considered first aid, wouldn't be recordable because of that. If you have an employee go to the doctor and they drill a toenail or a fingernail to relieve pressure or drain a blister, that in and of itself is considered first aid. Just using an eye patch, first aid. If they go in, if somebody has something in their eye and they just use a cotton swab or they irrigate the eye to remove the material, that's considered first aid. If they use a tweezers or irrigation or cotton swabs to remove things from areas of the body other than the eye, that's considered first aid. The reason I'm struggling with this mentally here is I usually do this in a different order. OSHA says, look, if you have to use a tweezers or a magnet to remove something from the eye, that is medical treatment. As long as they're just irrigating or using a cotton swab on the eye, that's first aid. And that one gets hilariously funny because you're like, an employee goes to the doctor, they get something removed from the eye, and then you got to call the doctor's office back up. Can you tell me exactly how you removed that from the eye? Did you use a tweezers? Did you use a magnet? Or did you just use a cotton swab? Because that is what makes the difference. And yes, this presentation is being recorded and it will be posted Thursday or Friday. And I will send a link out to everyone that registered with the link to the playback of this webinar. Massage is not considered medical treatment, it's first aid. But if it's PT or chiropractic treatment because of a condition, an injury or illness, that is medical treatment. Drinking fluids to relieve heat stress, not considered medical, excuse me. Drinking fluids to relieve heat stress is also considered first aid, would not make it recordable. Now, if a licensed healthcare professional recommends medical treatment and the employee does not follow the medical treatment, it's still a recordable case. If a doctor says you need stitches and the employee says, I refuse to get stitches, that's a recordable case even if the employee doesn't get stitches. Doesn't happen often, but it can occur sometimes. An employee loses consciousness. Got to record that, regardless of the length of time the employee remains unconscious. They're in the work environment, they're doing something, they pass out, it's going to be recordable. Now, if at a later time you learn that the employee passed out because They have 5 days or 7 days, I forget now, to get that injury or illness onto your OSHA log. And then at that point in time, if some point time after that you realize, hey, this wasn't recordable, you just line through it. And that's what OSHA wants to see. They literally want to see a line through the OSHA log. If you keep a paper log, if you do it electronically, you can do strike through on it, just so OSHA understands if they ever ask that, hey, we did contemplate this one, we thought it was recordable until the point in time we learned that it really wasn't work-related. And so that makes life more entertaining. Sometimes you have significant injuries or illnesses diagnosed, and this is where COVID is coming in. OSHA considers COVID to be a significant illness. You may have a person test positive for COVID that, this isn't true. COVID, a broken bone is a significant injury illness. We'll come back to why COVID isn't, at this point in time, considered a significant injury illness. But you have somebody with cancer or irreversible disease, fractured or cracked bone or punctured eardrum. There's really no medical treatment that might be given for some of these things, depending on what it is. OSHA says, look, if they're diagnosed with a cracked rib because they got kicked by a cow while at work, you're going to record that even if there is no other medical treatment. It's because it's significant because of that cracked or fractured bone. And then, as I said, there are certain OSHA standards that require medical removal, or they have medical removal provisions. Lead, cadmium, methylene chloride, formaldehyde, and benzene are the ones off that I remember. And so those, if an employee is removed from work because of that, you're going to record that on the log. And then you would count the days as appropriate. So let me recap. Did the employee experience an injury or illness? Yes or no? Is it an employee is the first question. Is it work-related, the second question. Is it new is the third question. And does it meet the general recording criteria? And again, this is where we get to COVID-19. COVID-19 has exactly the same process. We look, is it an employee? Is it work-related? And I know you're all going, but we don't know if it's work-related. We don't know if it's work-related, and I'll come back to that. So if an employee has COVID-19, and let's assume it's work-related at this moment, as long as they have medical treatment beyond first aid, they have lost restricted work days, they pass away, as long as there's something that makes it recordable. So that's box 4 on my chart there. And it was a confirmed COVID illness, not just assumed, but they actually had a positive COVID test as defined by the CDC, or positive for COVID as defined by the CDC. That doesn't mean they had to necessarily have a test, but that's 99.9% of the time how you're going to know that they had a confirmed COVID as defined by the CDC. Then that would go on the OSHA log. The kicker is the work-relatedness. OSHA gave, I should say, a process for determining work-relatedness. What they want employers to do, and I should say that this applies to employers outside of healthcare and emergency response anytime after May 26, 2020. They want employers to determine the work-relatedness. Give me a second here. I was just making sure the audio was still working on my other system. From April 10th to May 26th, OSHA had slightly different criteria in place. After May 26th, OSHA said, look, this is the process. OSHA says to determine if it's work-related, because remember I said, if it's an employee and the COVID led to lost work activity, restricted work activity, medical treatment beyond first aid, death, those are really the 4 that apply, and it was confirmed COVID case, you need to determine if it was work-related before you record it on your OSHA log. OSHA says, here's what the employer has to do. I can define it real quickly, but in practice, it's tough. First, you go and ask the employee how they felt they contracted COVID-19. Why do you think you got COVID-19, or how do you feel it's work-related? Second, while respecting the employee's privacy, I love the way OSHA words this, while respecting the employee's privacy, discuss work and out-of-work activities that led to the COVID exposure. Do you live with somebody that had COVID? Do you go to places in the community where COVID might have been present? Here at the work environment, what do you think you did that you received COVID exposure from? With that information, then you review the work environment and look for SARS-CoV-2 exposure, thus the virus that causes the illness COVID-19. And so you look at those things and you consider all those things, and we'll go on to the next slide here, and then you have to make a determination. So, if you have a bunch of employees working closely together and they get COVID, OSHA is saying, it's possible that the work environment led to that. If the employee works with coworkers or the employee works with customers that have COVID, OSHA is saying, that may make it more than likely that the employee got COVID in the work environment. If the employee had frequent close exposure to the general public in areas with high community transmission, which most communities had at some point or another, and there's really no other alternative explanation for the COVID, OSHA is saying, that possibly that it's work-related. And then if they had close, frequent exposure to someone outside of work that has COVID, and OSHA is saying, well, that's probably not work-related because it has nothing to do with work. So this is up to each employer. Workers' compensation, depending on the jurisdiction, it's going to be different when we make the determination if it's work-related for compensability purposes. But for OSHA's purposes, you really have to look at it. So you have an employee in the healthcare environment and they're working with people that are testing positive for COVID and they're providing direct personal care. I think most of the time you're going to have to say, yeah, this is probably work-related. You have an employee, they work on the loading dock, they drive a forklift, they're an antisocial individual, they don't take break with other people, they're always by themselves, and they come down with COVID, probably not work-related, especially if nobody else in the work environment or anybody near them had COVID. You're going to say, really, it's not more than likely that the employee had the COVID exposure. I can tell you that you can ask me all the questions you want. If I think something is work-related when it comes to COVID, I can't answer that for you. At the end of the day, you have to look at what are all the factors. What do they do in the work environment? What's their exposure in the work environment? Do they have close, frequent contact, lengthy contact with coworkers or customers, people that are in your work environment that might have led to that exposure? I don't want to say there's no right or wrong answer. It's a balance, and you have to really look at each of these cases and determine, is it more likely than not that exposure occurred at work? And it's a judgment call. Can be a tough judgment call. I get that, but this is the only guidance that OSHA provides, and I think it makes rational sense if you think about it. But for those of you doing it, I know it's miserable. I understand it's miserable, and so this is that process. So we're going to go back. Oops, we want to go back to that flow chart again. So I'm looking at box 1. Did the employee experience an injury or illness? So positive COVID-19, and they're an employee, that would pass box 1. 2, is it work-related? That's where you have to ask those questions, and you have to make that weighted decision. And most of this is going to come down to 2. 3, is it new? Thankfully, this one's relatively easy. We don't see a lot of employees having 2 cases of COVID yet. It's happening, but it's not that frequent. So they have COVID. We'll assume it's a new case unless they never had it before and they've just not gotten better, which is a different issue. And 4, does it meet the general recording criteria? This one gets tough. And I know everybody's asking about counting days. And this one's going to be tough, because if the physician takes the employee off work or they're so ill that they can't work, you're going to be counting those days. If the employee was taken off of work because the employer directed them to, I'm going to say you're going to have to count those days, because that is the way the day counting criteria works. OSHA says you took them off work, you're going to count the days. I know you're saying, but we had to keep them off work because we didn't want them spreading COVID to our patients, our customers, our employees. I get that. It's not necessarily the most rational thing we have to deal with in the world, and counting days when it comes to COVID. It's just, that's the nature of what we have. So, counting days, and I'll come back to the questions because I see lots of them. Count days. When you count days, you always count calendar days, not scheduled days. If they work 1 day a week and a doctor took them off work today and they can't return to work until Saturday, you're going to count Thursday, Friday, assuming they work on, even if they can work on Saturday, whether they do or not, Saturday may or may not be counted. So if the doctor says, look, they're off work through Saturday, meaning they can't work Saturday, you're going to count Thursday, Friday, Saturday. You're going to count 3 days, even if the employee isn't scheduled to work again until next Wednesday. You never count the day of the injury. OSHA always assumes they were at work the day they were injured, so therefore they were there, therefore they worked that day. You don't count that day. And you can stop counting after 180 days. That's 180 days of restricted and lost work days combined. It's not just 180 days of lost or 180 days of restricted. You can stop counting on either of those. Now, if the facility goes out of business in that 180 days, you can stop counting. Or if the employee retires or leaves the company for reasons other than injury, you can stop counting days as well. Maybe they were scheduled to retire on January 28th. They're injured today. And then you wouldn't count tomorrow because, hey, today was their last day anyway. All lost and restricted work days are counted on one OSHA log entry. This seems to confuse people. You know, we're in January of 2021. They're like, oh, they were injured in they were injured in December of 2020. They still have lost work days going into 2021. Do I create a new OSHA log entry for 2021? No. All those lost and restricted work days go back to 2020. We have situations where you might have an employee that was injured in 2018. They still get medical treatment occasionally. They have restricted work days occasionally. You know, if you're not over that 180 days yet, you go back to 2018 and update that log entry for that point in time. So it's a clerical nightmare at best. And do not count days where the employee takes themselves off. I just want to reiterate that. Had a few questions in the last few weeks about, we have an employee that they decided to take themselves off work. I don't care. You don't count those days. If the employer took them off work, if a supervisor took them off work, or a physician took them off work, then you count those days. But you don't count days just because the employee chose to do it on themselves. As we talked about, if you transfer somebody, you're going to count at least one day, at least the day that you transferred them. And this is a way that some people get around saying they never have a lost work day. They just have an employee that's supposed to be off of work or has significant restrictions. They say, oh, we just transfer them to a new job that it doesn't impact them. OSHA log posting. So that covers all of the OSHA log. And again, I'll answer your questions at the end. OSHA log posting. This is the summary. Oh, one thing I should mention on the COVID-19 cases, I forgot this. COVID-19 cases are considered an illness that you do not have to put the employee's name on the OSHA log. Should the employee say, I don't want my name on the log, you can do what's called a privacy concern case. Only illnesses qualify for privacy concern cases. And then what you need to do is you need to keep a separate list someplace in a file cabinet in a drawer that you say OSHA log entry 12, and it says privacy concern case on the log. That was actually Susie Smith. OSHA wants to make sure that you know that you accounted for all the cases, and so you need to keep a listing someplace of what all the privacy concern cases are. It is based upon the employee's request not to have their name on the log. How you approach that's up to you. But on illnesses, if the employee says they don't want their name on the OSHA log, they have the right to not have their name on the log. And for illnesses, it would go down as, like I said, a privacy concern case. But you need to keep a separate list then so you know what privacy concern case is which privacy concern case. The OSHA 300A. This is the summary. This is what gets posted in your facilities from February 1st through the end of April. And this summarizes the OSHA log entries for that location. Remember, you keep an OSHA log based upon the number of employees per the enterprise. The summary is really a summary for that location, or establishment is the term that OSHA uses. I could do a whole 1-hour presentation on what defined as an establishment in OSHA, and I'd prefer not to. But basically, if you have a location in Iowa, location in Wisconsin, location in Minnesota, they each get their own summary. They don't get a summary. They should not get a summary for the entire enterprise. They're going to get a summary for their location. Where this gets tricky is you have a number of employees working in one town at different buildings. Is that one location, multiple locations, and there's different ways that can be assessed. And I want to keep within the hour and 15 minutes here, so I'm not going to get into that. But this is the OSHA 300A. You're going to summarize the data, number of deaths, number of lost work days, number of restricted number of restricted days. You're going to have the number of cases with lost work days, the number of cases with job transfers restriction, total number of other recordable. If it doesn't result in death, lost work days, or restrictions, OSHA says it's other. You're going to summarize the total number of injuries and illnesses. I'm thinking about COVID-19, and I wished I didn't have this thought, because I don't know if OSHA is having COVID-19 put down as a respiratory condition or all other illness. And I can't look that up quickly because it's not going to be in any rational place. But if you really, really want to know, my email is going to be at the end. Feel free to send me an email, and I will look that up. I should have checked on that before, but I didn't think about it until just now. So for each establishment, as I said, they're going to get a summary posted. That summary is posted from February 1st to April 30th. That summary needs to be certified by the highest ranking official at that establishment. It's not by the person filling out the OSHA log most of the time, because usually the person filling out the OSHA log isn't the highest ranking official at that location. So if you're in HR, safety, or you're just a secretary and you maintain the OSHA log, there's probably somebody higher ranking at your facility that needs to sign that log. The annual certification summary, like I said, owner of the company, the officer of the corporation, or just the highest ranking official at that establishment. I only bring that up because it used to be anybody could sign the OSHA log, but a decade ago or about that long, OSHA said, look, it needs to be somebody that is the company official. And they're just certifying that it's right, or right to the best of their ability. You post that OSHA log, that 300A from April 1st to April 30th. You need to keep a copy of the summary for 5 years. If you, like 2020, that case that's still losing days, you needed to estimate in 2020 how many days we're going to lose to put on the summary. But if in late 2021 they lose more days because of the injury, you don't have to go and update that summary. The summary stays what the summary is. That doesn't get updated, but you do have to maintain and update the OSHA log for the past 5 years if there are changes. Let's see. Continuing on. Now, if you have to keep an OSHA log, you may have to submit your information electronically to OSHA, your OSHA 300A summary information to OSHA. And that needs to be done by March 1st. So by March 1st of 2021, if you have to electronically submit your data to OSHA for 2020, you have to have that done by March 1st. There's different criteria for who has to submit their log information to OSHA, their summary information to OSHA, than for keeping a log. The first is establishment size, which we'll come to. So if you have an establishment, a location of more than 250 employees and you're required to keep a log, you then need to submit that information to OSHA, electronically to OSHA. I do have the comment here about multiple facilities on one campus are generally considered one establishment. You know, let's say you have a square block and you have 4 buildings on it and there's 80 people and 90 people in each building, a total of 360. OSHA is saying, look, you can't do the 90 people. You can't say, oh, we only have 90 people per building. That doesn't meet the requirement. So OSHA says, generally, on one campus, look at the total number of employees. Don't want to get into that. There are times where you can establish multiple facilities on one establishment. Multiple facilities on one campus can be split into separate establishments if all of these 4 bullet items are true. It's not one, it's all 4 have to be true. And usually the last one is the one that does it in. If you're not keeping separate reports of wages, hours, salaries, etc. by establishment, then it's that. There are other criteria than the 250 employees. Oh no. There's establishments, and you can ignore all those other slides. They appear to be out of order. There's establishments. If you have 20 to 249 employees and you're a high-risk establishment, OSHA says you also need to submit your log electronically, your summary information electronically. Now, your definition and OSHA's definition of what is high risk probably varies significantly. Because if you're in agriculture, if you're in manufacturing, those are all high-risk establishments. If you are a department store, if you're a used merchandise store, if you're a trucker, if you're a bus system, if you're a taxi service, if you have school bus operations, those are all high risk. So if you have more than 19 employees in those establishments, you're going to submit your OSHA log electronically. question was asked, they may fluctuate between 230 and 250. I'm going to assume they're not in high risk, because if they're in high risk, they're going to be submitting their log. But if you go over 250 total at any point in the year, you need to submit electronically to OSHA. And so again, here's the list of high-risk establishments. It includes a lot of things that you may not consider high risk. Sightseeing operators, for me, wouldn't appear to be a high-risk industry. They're a high-risk industry. Lessors of real estate, so property management companies that rent out real estate, they're high risk. The one that's not on here is school district. So hold on, let me double check that. I want to make sure I don't mess up. I don't see school districts on this list. So school districts, not considered high risk. But if you had more than 250 employees in your school, if you had more than 250 employees in your school district, then you would be submitting your log in most states. So OSHA has a website you go to. If you've done it in prior years, I think you use the same login information, and they probably have a forgot password button. I've never done it. I've gone to the website a few times. And yes, trucking is high risk. Almost all forms of transportation are considered high risk. So you go to that website and you submit that information. So there's 3 options to submit the information. You can manually submit it electronically through their website, i.e. type it in. They do have a process to upload a comma-separated value file for single or multiple locations. And some OSHA record-keeping software, if you have separate OSHA record-keeping software, they have an API or an electronic way to submit that data to OSHA. And to the best of my knowledge, it used to be virtually all states use the same site. I think they all do now. I can't think of a state that uses a different site other than the one I've listed below for doing that electronic submission to OSHA. Yes, long-term care facilities are high risk. Getting to the end of the presentation here before I get to the questions, injuries requiring OSHA notification. I can tell you, if you have an injury that you have to tell OSHA about, it needs to also be on your OSHA log. So, injury reporting to OSHA. No business is exempt from reporting these injuries that meet these criteria to OSHA. The injuries are, well, I'm going to give you an exemption first. If it's a fatality, a hospitalization, an amputation, or loss of an eye, that's an enucleation, that a result of a motor vehicle accident on a public street or highway does not need to be reported. However, if it is in a construction zone, it needs to be reported. So this is the only time you could have a fatality that does not get reported to OSHA. Fatalities, and you want to pay attention to this when it comes to COVID. Fatalities, you need to report a fatality to OSHA within 8 hours of the fatality occurring. If your organization has a work-related fatality or hospitalization caused by heart attack, COVID, you need to report it like any other event. Now, here's where COVID gets tricky. The individual has to pass away within 30 days of the work-related event or exposure. So, if the employee dies 31 days after the anticipated event that led to their exposure, or the date of their exposure, which is going to be tough to tell for COVID, you don't need to report it. But if it's within 30 days of the date of exposure, you need to report it. If it's more than 30 days, you don't. So that one gets a little tricky. Fatalities, most people on COVID are generally lasting more than 30 days, but it depends. Fatalities are what fatalities are. Hospitalizations, OSHA says, look, if you have an employee that's formally admitted to inpatient service of a hospital or clinic for care or treatment, so we're talking something beyond observation, within 24 hours of the work-related incident, then you need to file OSHA within 24 hours. Fatalities, remember, is you have 8 hours to notify OSHA. Hospitalizations is 24 hours. Here's the thing. Most COVID cases aren't getting hospitalized within 24 hours of the incident. And so for most hospitalizations related to COVID, should you have one, you don't have an obligation to report to OSHA because it would have been, the exposure would have been more than 24 hours because it takes, 5 to 7 days just for the signs and symptoms to develop from the time of exposure to the time of the onset of the reaction. And so this at first was a contentious issue between agencies and OSHA about, OSHA wanted to, initially OSHA said you had to tell them about all hospitalizations, and then some wise individuals said, look, this violates your own criteria. You say, look, it has to be within 24 hours of the work-related incident before you'd have to call. And they're saying most cases, nobody's getting hospitalized for COVID within 24 hours of the exposure incident that led to them developing COVID. And so rarely, I can't imagine a situation where you have to call OSHA about a COVID hospitalization. COVID fatalities, yes. A number of businesses have already been cited because they did not report COVID fatalities where OSHA felt it was clearly a work-related exposure. And I don't know, that's probably a $3,000 to $10,000 penalty. I haven't seen the actual numbers on these since they're relatively new. So you have a fatality, work-related fatality, call OSHA if the employee passes away within 30 days. You have 8 hours to get that done. If you have a work-related hospitalization where they're truly admitted to the hospital for treatment or care, and they're hospitalized within 24 hours of the incident, you have 24 hours to notify OSHA. Amputations. Amputations, OSHA has this wonderful definition because it's even partial amputations are considered amputations. It doesn't have to be a total severing of the limb from the body, but partially. OSHA says you need to notify them. Now they get into, you do not include avulsions and you do not include avulsions, deglovings, scalpings. And so sometimes an avulsion, difference between an avulsion and a partial amputation apparently is the involvement of skin, but I would go back to the doctor and ask, hey, is this an avulsion or is this an amputation? Even if it's a partial amputation, you're going to tell OSHA. And again, that has to occur within 24 hours of the incident. So let's say the employee has a severe injury to their hand and a crushing injury to their hand, and the doctors observe it for 48 hours and they don't amputate it, but at 48 hours they said, you know, this isn't going to be recoverable, we're going to amputate it. That wouldn't be reported to OSHA because it happened more than 24 hours after the time of the incident. If they get there and the doctor's like, we need to cut that finger off right away, well, because the doctor makes the decision to do the amputation, that still gets reported to OSHA. So we don't care if it's a surgical amputation or the injury caused the amputation itself. If it happens within 24 hours of the incident, then you have to notify OSHA. Loss of an eye or an enucleation. OSHA says, look, if you have an activity that results in the physical removal of an eye, then you need to call them. Again, this is, the eye is physically removed. Again, it could be by a physician. Recently, or within the last 2 years, we had an injury where an employee was injured in the eye, and ultimately the doctors decided the eye had to be removed, but the surgery to remove the eye was more than 24 hours beyond the time of the incident. So they didn't have to report it. But if the employee loses the eye falls out, comes out, eviscerated within 24 hours of the incident, needs to be reported to OSHA. So not a lot of these. Just purely loss of sight. I mean, the person could be blind, but if the eye isn't removed, you don't have to report it to OSHA. And OSHA drew that line, and I think it's an interesting line that they drew, but physically separating the eye from the body is much easier to tell than assessing how blind somebody is, if they're 80% blind or 90% blind. Perry asked my least favorite question, what if the surgical amputation is scheduled within 24 hours but takes place more than 24 hours? Me being, I'm looking at what the intent of the law is versus the letter of the law. I would call OSHA up and tell them. I'm not saying that's legally what you have to do because it's kind of a gray area, but the intent of the law is, look, you notify OSHA of significant injuries or illnesses. And I'll come back through all these questions because I see there's a lot of them. So how do you report injuries? In federal OSHA states, so Illinois, Wisconsin, Missouri, Nebraska, thinking here, most of those states, those are state plans, those are federal OSHA states, so you just call OSHA up. In state plan states, usually your state, so Minnesota, Iowa, Indiana, Michigan, Minnesota, they have a number you can call during regular business hours, and we just did this in Minnesota, or had an insured ask about Minnesota. Outside of regular business hours in Minnesota, I know you call the 800 OSHA number. And so just check to see, what your state is, if you're a state plan state. You can go to OSHA's website, www.osha.gov, and somewhere on there they have a map, and you can click on that map, and it tells you if they're a state plan state or a federal state, and if you don't already know. Usually, though, most states are okay if you call 800-321-6742, which is the federal OSHA reporting number, and they'll get that information back to the state. I can tell you when OSHA first implemented this, they were quite surprised. They were overwhelmed with the number of notifications they got when they implemented this 5, 8, 10 years ago. I forget the exact year. I think it was about 10,000 reports they had in the first few months. And initially they intended to go do inspections on all these, but they were quickly overwhelmed and decided, we can't inspect all of these. We need to do some assessment. So we're at the end. So many questions. Yes, this was recorded. I will send a email out on Friday to everybody with the link to the recording, because I have to get it. I have to download the recording and do some things with it and get posted to YouTube. But it is recorded, and everybody that registered, if you're here, I'm assuming somebody registered because you can't get in without registering, I will get you a copy of the recording. So I am now going through the questions. Way at the beginning, Joe asked, if an employee tests positive for COVID and it's recordable in the OSHA log, do we count days away from work for isolation on the OSHA log? If you kept them away, doctor kept them away, I don't see any way around it. I don't see any way around it, because the intent is to count days where the employer or physician removed the employee from work or kept them on restricted work activity. It says, if an employee has a work-related injury, goes to the clinic to be seen, and is told they can return to work with no restrictions, do you still record? Well, you wouldn't count restricted work activity, but I need to know what the medical treatment is. Did they have medical treatment beyond first aid? Did they get prescription meds? Did they get anything, a rigid stay? Did they get medical treatment that would have made it recordable? And so it's always important. You got to look at all those things. It's not about purely lost restricted work activity. If there is lost restricted work activity and it's work-related, a new case, they're an employee, automatically recordable, but you have to work through that process. If there was no lost time, no restricted work activity, was it a serious injury illness, diagnosed serious injury illness, as I said, fractures, those types of things, and then you have to look at the medical treatment. Should they have medical treatment beyond first aid, then that would make it recordable. It says you have an employee walking into your work and falls in your parking lot prior to punching in, but does not get hurt, but possibly twisted a knee or fell, and you're not sure if it's later. Do you report this? I'm assuming recordable from an OSHA perspective. Again, it doesn't go on your OSHA log. If they got injured in the parking lot to the point that it was medical treatment beyond first aid, had lost restricted work activity, then you would record it. But based upon the question that was asked, they fell in the parking lot, they did not get hurt, possibly twisted a knee, it's not recordable until that time. It's not recordable until the ever lost work time, restricted work activity, medical treatment beyond first aid. A temporary transfer pay is still a transfer. If you're moving them to another job for a day, you're going to count a day of transfer when it comes to restrictions. It says, what about a personal injury that prevents them from doing aspects of the job? No, if it didn't happen at work, if it's not work related, if the incident's not work related that led to the injury, then you don't have to, that would not make it recordable. So if they were injured at home and they come to work but they can't do a part of their job, that's not recordable because the injury was not work related. What if the doctor prescribes over-the-counter meds? That question was asked. I haven't seen that in a long time, but basically you have to go and look and assess what was the employee prescribed. And right now I don't remember Tylenol, for example. I think 2 500 milligram tablets of Tylenol is over the counter. I'd actually have to go to the store, buy some Tylenol and stare at the container. But so you really have to look at what were they prescribed versus what can you buy off the shelf. As long as the employee wasn't told to exceed what's on that over-the-counter label, if it says take 2 500 milligram tablets per day, and that's 1,000 milligrams in a day, and the doctor prescribes 2 500 milligram tablets a day, then I would say no. But if the doctor says, look, go to the pharmacy or go to your Target and pick up Tylenol and take 4 of those a day, take twice what's on the label, then that is prescription strength of that over-the-counter med. Still looking. It says if an employee gets COVID-19, is required to stay at home for 10 days and does not get medical attention. Is that reportable? The answer to that is no. And the reason is because they didn't have medical treatment beyond first aid. Let me go look at something. I got to go back in the presentation. There's a caveat to how that OSHA wrote this. So let's go back to those slides. We'll work through this together. I could be wrong in how I initially spoke that, but I wished I could go back faster. Yeah, so I was wrong. So if the employee is confirmed COVID and it's deemed to be work related and you took them off work, it needs to be counted. There's no way around that with the way they wrote their criteria. There was a question asked by Melissa. It says, what if they were working remotely during the time they had COVID because they were asymptomatic? We go back to, was there a confirmed COVID diagnosis by the CDC? That doesn't mean the CDC says, look, if you have a positive COVID test, that was positive. There's a few other criteria that the CDC has that also says, yes, it is COVID. So it's more of a medical thing than I can assess or talk to you about. It says, would that be lost time if they were working remotely during COVID? No, those would be potentially restricted work activities, depending if they were restricted or not. Now, let's say they were a clerical employee and they were doing absolutely the same thing at home that they were doing at work, then you would not have to count those as restricted days because their work activities were not restricted. And so again, you have to assess based upon how we were talking about counting restricted days. Does it restrict their activities? Doesn't talk about where they can do the work. It doesn't talk about anything like that. Does it restrict their work activities? It says if an employee was quarantined due to being exposed and to a positive employee and they were in close proximity, is it recordable? That goes back to if the employee ended up being tested negative later on. No, that would not be recordable. Sherry asked a question about what happens if they go on lunch in a break room. Is it on break? No, if it happened in the work environment, OSHA doesn't care if it's in the work environment and they got an injury, an illness, or contracted COVID while on break in the work environment, that's going to be considered recordable. Now, if they're a smoker and they were out in a smoking hut off property, or excuse me, you wouldn't have a hut off your property, but they went off property to a public park because you don't let them smoke on campus and that's the only time they think they got COVID, then I think you'd have a really good ability to say, no, that is not work related, but quite nitpicky, and so you'd have to evaluate all those things. Christy asked about the process for determining work relatedness for outside of healthcare. Basically, OSHA says, look, if you're in the healthcare environment and you had people test positive for COVID and they were dealing with individuals that had COVID, you can almost assume it was work related. I would say you can still take some of that general philosophy OSHA had. Were they providing care to individuals with COVID? Were they in close proximity to coworkers that had COVID? Were you providing PPE and were they using that PPE? And this gets to be tricky because people were getting COVID before we realized they needed to have PPE in place. So it's a little more complicated to make that determination, but basically OSHA is saying if you're in the healthcare or emergency response fields, it's almost going to be presumed to be COVID unless you can really show it wasn't. So it's a little higher burden there for saying it's work-related or not. Question was asked if they have confirmed COVID twice, is that considered a new or re-aggravated case? I like that question due to the fact that we really have to go back to consider. OSHA says if it's a new case, if all their signs and symptoms went away. And so if you have a medical doctor that says, no, this is truly a new case of COVID, and you feel that the first one and the second one are work-related and meets the other criteria, then yeah, you're going to have two COVID cases from the same, two recordable COVID cases from the same individual. Sabrina asked the question, what happens if the employee was not treated by a physician but stayed home because of the public health required quarantine but not required to stay home by the employer? I would say the employer did not direct the employee to stay home, the physician did not direct the employee to stay home, and we'll assume they were COVID positive, then you don't count those days. It's just the finite difference. And I know you people are throwing your hands up in the air and pulling your hair out. I get that. It's just the finite differences in the exact language of how OSHA writes this. Kristen asks, is there a limit on counting days for work transfer? You count at least 1 day for transfer, and assuming that you transfer them to a position where their restrictions don't impact that transfer, then you'd count that. Now, it could be that you have a restriction, it's significant, you transfer them to a new job, and the restrictions still impact them on that new job. And so you can continue to count those restricted days until the restrictions no longer were impacted the functions, the routine functions of that position. Amber asks if you can stop counting at 180 days. Is that per employee or facility? That's per employee. So you can have multiple 180-day cases. People asking about whether it's respiratory or other. I'm going to say it's respiratory. OSHA's not going to come and clobber you if you're going to get hurt more by OSHA if you don't count the COVID case than if you mark it was respiratory versus other. COVID is a respiratory illness. It's the coronavirus that causes it, and so I think it would be hard pressed, but I'm not losing sleep over that. I will look it up for anybody that wants to know, though. Sherry asked the question about submitting electronically if you have 250 employees, and the other criteria is high hazard. Trucking is high risk. Healthcare is high risk. Barbara asks about 7211. Barbara actually has a unique situation. Golf course with overnight accommodations. I don't want to get nitpicky, but that could actually be two different businesses. Depends on how they keep their records and logs. And then how do you pick which one you go under? Do you go under hospitality or do you go under the golf course? And usually it's going to be the one that has more revenue. Is just a rule of thumb. It's not the exact. But 7211 is considered high hazard, so therefore you have more than 20 employees, you would have to submit electronically to OSHA. Dawn asked the question, we're a county government in the state of Wisconsin. Do we have to submit electronically? And the answer to that is no. The state of Wisconsin is not requiring you to submit to them. The only reason you have to keep an OSHA log is because the state of Wisconsin requires that as a public entity. But the requirement to submit that electronically to OSHA, you don't meet the requirements because of that. And I'm 98% positive the state of Wisconsin does not have a process to collect that information. But I think in Wisconsin anyway, again, little nuance, I think you have to send a copy of your log to OSHA, or to the state. You have to send something to the state, paper, and that would suffice for the electronic transfer. Question was asked if you have an injury in 2020 and the employee finally loses time in 2021, it goes on the 2020 log. It always goes back to the date of the incident or injury. Andy has 2 locations doing similar, same business. I can't answer the question, Andy, because I have to know they co-located together. Do employees really report differently? Basically, it comes down to if you should have an unemployment poster at both locations, you should have a summary at both locations. And the summary is going to be specific to those locations. And so that one's a little tricky, not a lot of information given. What is the separation between quick care and observation for hospitalizations? The question was asked, basically it gets down to what are they doing to the individual while they're in the hospital. If they're truly there sitting there staring at them, that's going to be observation. But if they're doing anything to them, that's going to be beyond first aid. So if they have an IV, that's more than first aid. If they're giving them pain meds that aren't over the counter, that's going to be more than first aid. Whether or not, and that's going to be considered hospitalization because they are doing something. Question was said, if you notify OSHA of a fatality, it should be on your OSHA 300 log. The question is asked is, what happens if later on we turn out it's not work-related? A perfect example is a heart attack. An employee in your work environment has a heart attack. You're going to call OSHA because they passed away assuming they passed away within 24 hours of them hitting the floor. You're going to call OSHA and report that. OSHA is going to ask you, what were they doing? I said, well, it looks like they had a heart attack. OSHA 99% of the time is not going to come and do an investigation on the heart attack. Later on, you found out that they had a heart blockage and 99% heart blockage, and like the doctor's like, no, this isn't work related. They were going to pass away no matter where they were, or they had an aneurysm or something. So no, then you'd cross it off the OSHA log. So you may have to call OSHA for something. You may have to report something to OSHA that ultimately is determined not to be recordable, and that happens. Melissa asks my favorite question, another favorite. We had a work comp claim filed for COVID exposure, and that was denied by the carrier. Is that recordable? Can't answer that. You as an employer have to do your own assessment to determine via OSHA's criteria if it's recordable. OSHA's criteria and your state's workers' compensation criteria for COVID is not going to be consistent, because state to state, what is compensable under COVID is not consistent. Whereas COVID from an OSHA recordability is consistent state to state, because I can't think of any state that's adopted anything different. Alex asks about 800 milligrams of ibuprofen for a few days. I would say, Alex, grab a bottle of ibuprofen and see what the bottle says. I love the question, Amber. Amber says, have an employee test positive for COVID. However, in certain states said, go ahead, let them work because they're working with patients that are COVID positive. Do you count those days? And say, no, the COVID did not impact their ability to work, and they were working. And so it gets to be interesting. Would you even count that then? The bigger question is this OSHA recordable? Hypothetical, have an employee test positive for COVID. They're working with COVID positive patients anyway. You're short-staffed. The state says, not a problem, let them work. They don't receive any medical treatment. They're asymptomatic. I'd say that's not even recordable. But the same employee, you say, no, you can't come to work, you're going to miss time, then it is recordable. And just that decision makes that the difference. Mary's question, public health tells them to isolate for 10 days. It depends on how that impacts them. They could isolate in their home and still do their full job, so that wouldn't necessarily be lost time or restricted time, and it wouldn't be recordable. And so you really have to think about that as what did it impact them. Kathy asked, could I go over again what's deemed work-related with COVID? And, we have to assess what's the employee's exposure in the work environment. Did they work in close proximity to staff members, patients, customers that could have or would possibly have COVID? Do you have a cluster of positive COVID cases in your workplace? What's the employee exposure? If the employee is a clerk, like I gave the example, they work in a warehouse, they don't see anybody. They just, product comes through the wall on a conveyor, they put it away, and they ship product out on a conveyor, and they don't see anybody, and they come down with COVID. You have a really good chance of saying, there's no way this is work-related. Now you find out that this employee plays cards at break time in the company break room, and you pack 60 people in a break room designed for 20, and everybody else in the break room had COVID, then it gets to be questionable. It's a judgment call that each of you have to make. And so you just have to look at the facts surrounding each case individually, what the employee does, who they interact with. And then, you find out, do you live with somebody? Yes. Did that person test positive for COVID? Yes. Then, that weighs on that. And OSHA recognizes the challenge here is that we're in a pandemic. COVID is occurring to people within the workplace and outside of the workplace. We recognize that there's families, that everybody in the family but one person gets COVID, that the transmission of it is not uniform. And so OSHA says, look, you need to make a good judgment here, evaluate the details that you have, and decide if work is more likely or not the cause of the COVID. Tanya asked a question about you send somebody home because you think they have COVID, but they never test positive, then it's not recordable unless it meets the other criteria. But testing is usually the same way. Most people go about determining if they have COVID. If a physician says this employee has COVID, but they never had a positive COVID test, then you're going to say, yes, that is, they had COVID. There's, I think, one other criteria that the CDC has as being confirmed COVID. Test is, 99% of the time. Initially, when there was a real test shortage, if a physician diagnosed somebody as having COVID, even though they didn't have a positive test, that would still count. But we're not at that time. We haven't been at that point for some time now. Katie asks, if the employee is positive for COVID, doctor tells them to stay home, but you don't believe it's work-related, do you count on the OSHA log? Again, you got to go through the process. Is it work-related? Did they have medical treatment or lost work time? Medical treatment beyond first aid, lost or restricted work activity? Is it an employee? Is it a new case? All those things. So you got to go through all those steps. Of course, are all COVID cases recordable? Absolutely not. Yeah, if the question was asked, if the CDC says, employees should stay home for 10 days because they're COVID positive and the employer enforces that, yeah, you're going to count it. As long as the other criteria are met, that it's work related. Kristen asked the questions, can I go over the transfer and restricted work days again and counting those? You have a truck driver that transfers to a building maintenance position. Do you stop counting transfer restricted? Assuming they're going back to being the truck driving. No, at that point in time, it's just simply light duty. You're having them do a different job for a period of time, and so you'll count all those as restricted work activities because your intention isn't to keep them in the maintenance position. So we'll look at this two ways. Have a truck driver gets injured. You have them come in and do light duty. You're having them work in the maintenance department, organizing, whatever. So you're counting those as restricted work activities because their work activities are restricted until that point in time they can go back to being a truck driver. And we're assuming that the restrictions impact them from being a truck driver. The other case, though, is you have an employee that has a terrible back injury, and you know right away that, or you know shortly on that they're just never going to recover from this, but they could sit in maintenance and organize paperwork full time. So in that case, they have the injury, you're counting the lost restricted work activity as appropriate until the time you decide to transfer them permanently to maintenance. Once you transfer them permanently to maintenance, then you stop counting at that point in time. Again, assuming the restrictions don't impact their new maintenance duties. Betsy says Wisconsin Department of DSPS, which is the safety organization, they say you have a requirement to report similar to OSHA, and I don't know if she means electronically or not, but again, I know you do. You used to have to submit, I believe it was a paper copy of your OSHA log or maybe the summary to the state. So for those of you in Wisconsin that are a public entity, so school districts, counties, municipalities, I'm sure I'm missing some, we can get you that information. I'm in Wisconsin a few days of the week, but I don't always remember exactly what they require. Says an employee gets COVID, comes back to work after the 10 days of isolation, and the work later ends in the hospital. Is that reportable? Again, you got to go through the criteria, work-related, and then if you feel it's work-related and then they're a hospital, that would be recordable. Whether or not you have to call OSHA and tell them that you had a hospitalization is no, because that looks like that would have occurred clearly more than 24 hours after the exposure. Terry asks, if we determine that the employee got COVID outside of work, is that recordable? Nope, not work-related, not recordable. This person asks, if the employee was compensated, I assume workers' comp. Oh, Christine asked a question. If the employee was compensated for being off after testing positive for COVID, is that recordable? I'm going to take this from two perspectives. One is workers' comp covered it. Is it recordable? And I would say most likely, but not necessarily always. If you had them out and they were getting the federal reimbursement for positive COVID, and I can't think of the name of that program now, the loss of wages has nothing to do whether or not it's recordable. It's going to be the fact that they were removed from work and therefore it appears they were removed from work, and therefore it would be recordable, assuming it was work related and they had it and they were positive according to the question. Andy asks, if you have employees reporting to a location but they never enter the building, do you need to post outside? You put your posting of your OSHA log summary the same place you'd have their unemployment poster and the minimum wage poster for those employees. And so however you handle that is what you would do. It makes it entertaining, because you may have employees that traveling salespeople, ultimately they get tied back to a location, and so whatever location you tie them back to, that's where you're going to post for them. Brian asks a question, employees contracted COVID outside the facility. Well, if it was outside the facility, I assume it's not work related, and if it's not work related, it wouldn't be recordable. And the last question I have so far, re-clarifying on that transfer restriction. So an employee's out 200 days. Yeah, you can cap that at 180 days, and maybe it's 90 of lost and 90 of restricted, 180 of lost. I would just progress through the calendar until you get to the 180 days. So if they have a few days of lost and a few days of restricted and a few days of lost and a few days of restricted, just however you get to that 180 ultimately is that is where I would stop counting, is that 180 days. You can count beyond that, but it's just going to hurt you. Kate asks a question that I've covered in other years. It says, if an employee is based out of our corporate office and gets injured at one of our facilities during an on-site visit, basically which site's log does it go on to? And OSHA says you get to pick, just whatever you do, be consistent for other employees that are injured in the same situation. It says we have this happen occasionally. It says someone gets injured and they're laid off. Maybe it was a disciplinary problem. Maybe it was performance issue. Maybe it was because of lack of work. Maybe those types of things. You count the number of days that the doctor is telling them that they're going to be lost or restricted. This gets complicated due to the fact that employees heal much slower once they lose their jobs. And so if the doctor says, look, they were going to be off work for a week, you're going to count 7 days or whatever it was. If you know that they should have had some restricted work activity, you can ask the doctor, do you think they would have been restricted? You don't have to. There's no clear part on the restricted. Usually we know the employee is going to be off work for a certain period of time. And then from there, we know that there's probably going to be restrictions. But at that time, the employee's still getting treatment. You might be able to go to your work comp carrier and say, hey, do you have any idea if the doc gave them restrictions? And you're just going to continue to count like they were at work. Dan wants to know, can I please define long-term care? I'm assuming he means in regards to high-risk establishments, so 6231, nursing care facilities. You'll see that's pretty broad when it comes to it. What I would encourage you to do is go to, there's a website, a government website, where you can look up NAICS codes, and it will give you the definition of any code. And that's also how you figure out what you're in, because sometimes you go, oh, well, we do this or we do that, and you're like, which one fits us best? But long-term care is basically anytime you have people in where you're providing care for an individual in a bed in your facility. And if it's not nursing care, then it usually falls under the residential mental retardation, mental health, substance abuse facilities, or community care facilities for the elderly. So 6231, 6232, 6233, and 6239 cover about any situation where you have somebody living in your facility and you're providing any care above and beyond. It's just they're living in an apartment. Assisted living would be, I think, 6239, but I'd have to look at the definition. Courtney asks a great question, and we kind of talked about it. It says, a preschool teacher is allowed to work at home for 10 days due to COVID exposure, which is company policy. Is that considered a transfer restriction? They are still working, but not completing primary duties since they normally would be with students. I would I'd say that's a recordable case, and then it's restricted work activity. But you might have a payroll clerk that tests positive for COVID, got it at work, but you just had them go work at home the 10 days or 14 days, whatever you kept them away. And that wouldn't be recordable just because the employee was doing their regular work activity. And this is where it's a little bit different. I talked about if they had this is where OSHA says, look, for COVID, it needs to be positive COVID test, needs to be work-related, and it needs to meet the general record-keeping criteria, meaning lost work time, restricted work time, or a medical treatment beyond first aid. So you can have cases where, while they are not in your work environment, but if they're still doing their regular job at home for that period of time, it is work-related, you determine it's work-related. It is positive test because they had a positive test, but their work activity is truly not restricted. They're doing it someplace different, but they're still doing the same thing. That is not restricted. And so it's important to keep that in mind. So thank you all very much for your time today. I'm sorry this went 27 minutes longer than planned, but not at all unanticipated. Take care.